Okay, so this is what heart transplant. Well, what is heart transplant? Heart hemodynamics. On left side heart and right side heart, and then the circulation. Okay, take gradient and then normal rate hemodynamics. But when the patient with heart failure and then heart doesn't function well, and then patient may develop and a low output syndrome or congestion. And then, we change the heart. And then hemodynamic improve. Okay, this is heart transplantation, but we don't know when the donor comes and from whom and what type of, what quality of organ comes. So heart transplantation is very challenging. And then, there is a ventricular assist device and left ventricular assist device just to like in the salvage of the heart, like bypass the hemodynamics. And then left ventricular assist device is also the bypass of the right heart side heart. Okay, so we don't know when donors comes. So the country is very few organ donation. We use such type of ventricular assist device for waiting. And then when did it happen of the time? When is the time of the transplantation? And then so you may heard of the word brain death. So a few days after the death, the brain death, the heart will eventually stop. And then so this, there is a time and there is a short few days here, brain death to the heart stops. This duration is, this period is called brain death. Okay, normally this is the normal functions in the brain is described here. And then the vegetative state, patient can, the function of brainstem remains. So patient can, maybe breathe by themselves, and then, but they cannot, they are like sleeping. It is vegetative state. This is not called brain death. We cannot take organ from this. But brain death is completely including organ stem, the brain function stops completely. So patients eventually, and then they die within few days. And then what is happening at the time of transplant? The recipient hospital, so their information is they sent to the transplant network. And then if the brain death donors occurs, donor happens, and then the information is also collected by the transplant network and dispatched the transplant the coordinators, and the computer-based selection of potential recipient was they perform, and then the information was sent to the recipient hospital, and then the team was sent and then for the organ procurement, and the organ was transported, then surgery. So many people are involved in transplant. And the course of heart failure is like this. And then so not like the cancer malignancy death comes very quickly after the diagnosis, but heart failure the low cost, but the like radiant, so in a state they stable and then get worse and then stable and get worse like this, and then the dementia state and then low and then the other quality of life and then eventually they graduate and coming to the death point. So it is very important to be diagnosed first, and then early detection and treatment is very important for heart failure treatment. And then there is some application to predict patient death or requiring the heart transplant or RE, RE preparation for possible requirement for heart failure. So there's for the heart failure scoring and this is the most popular the scoring system called Seattle Heart Failure Model. And then if you Google, and then you can put the Seattle Heart Failure Model, and then if you click like this, and then this type of sheet is coming, and then you put the data of the patient, okay, and the projected the prognosis would be like the 29% you can tell. And then if you put like ACE inhibitors or beta blockers, and then you can optimize the patient medication, then now you know the survival after 5 years is the improvement. So put the medication, and then if you click here, and then you can predict, and then you click here, using this application, and you can predict the survivor is getting better or not. Okay, and then the important prognosis prediction in heart failure is the list of the patient and the several risks are described here. And then about the indication, I will skip this slide, but the patient is very severely ill, and then if you cannot save the patient's life without heart transplantation, that is the indication. Okay. The reduced cardiac output and then ejection fraction is less than 30%. There's some of the key for the requirement of heart failure, it's heart transplantation. And you also, so like Barnes, the having heart transplantation would be sometimes save the patient, but the heart transplant life is not always feasible. So sometimes you have to judge if the patient really requires heart transplant or not. And then decision making is very important. That is why, and the supply of organ is inadequate, the number is not equal. So you have to provide the organ to the patient really necessary for that organ. And this is ventricular assist device. And then, so you see like this is the pump. This is doing this like a substitute heart, the heart does, like this. And then, so someone put, this is now this is the implantable type ventricular assist device is mainly used. And the patient can take going to the side screen and using the devices. But it is not like a permanent rescue. And then the result, the outcome after the mechanical circulatory support is they described here. And the survival after the mechanical circulatory support is, 1 year survival is about 82%, 2 years, 73%. And then, but there are many, the complications after mechanical circulatory support. And sometimes device malfunction can occur, and the rate is about 55%. So at 1 year, so device is not like transplantation, so patient may encounter many complications. And the infection, and because the device connector is like sticking from your abdominal wall, so the infection can occur, and about 50% patients may develop some infection. And the neurological complication can also occur. Patients have to be anticoagulated. So once stroke happens, the stroke is very so it is so devastating. Very severe. Getting the patient may the brain function can be damaged very much. So, but I want to say the major role of mechanical circulatory support is providing some time for physicians and also their patients. A lot of mechanical circulatory support in cardiogenic shock are described here, and the possibility of heart recovery. And even if heart does not recover, you can provide circulation to the peripheral organs. And then also we can have a time to gather information and decide what we should do next, and then provide family members with time to accept the possibility of patients himself or herself death. And then mechanical circulatory support for cardiogenic shock actually save half-life of the patients. Well, I don't want to say details here, but if there's no mechanical circulatory support, 100% of patients die at this time point. But now half of them survive because of thanks to the mechanical